Dear colleagues, my name is Laszlo Tobar. I'm specialized in the diagnosis of breast diseases. I'm delighted by the invitation of the National Screening Center of Georgia to give a 2-day continuing medical educational course in your capital on October 13th and 14th this year. The course material will be based on my 45-year experience in the diagnosis of breast diseases. The unique feature of the course is the constant correlation of large format, three-dimensional histopathology with the different imaging modalities, and also from nature, explaining every detail seen on the mammographic image, both when concerning normal and malignant pathology. Here we see the major lactiferous ducts projected on the mammogram, the terminal ductal labial units, as well as the adipose tissue. Also here you see the so-called pattern 1 compared to the pattern 4 mammographic parenchymal pattern. But then you see the mammogram, the specimen X-ray, and the large format thin section histology. But the mammogram didn't show the tiny stellate lesion. And on this picture we see the correlation between the automated breast ultrasound, a specimen X-ray, and a three-dimensional histopathology image. The breast cancer subtypes will be grouped according to their site of origin, and the recommended most modern terminology will be explained during the course. Here we see the three-dimensional histopathologic image of about 75% of all breast cancers. These cancer subtypes, however, originate from the major lactiferous ducts. They account for about 20% of all breast cancers. And here is the magnetic resonance large section histopathologic correlation. And eventually, there is about 5% of all breast cancers that originate from the mesenchyme. They are very deceptive. We wrote a 3D book about it. They are concave, they are palpable, unfortunately large, and very difficult to control. As you see here, there is an 8-centimeter carcinoma hardly visible on the mammogram, but very well visible on the automated breast ultrasound as well as on magnetic resonance images. Both the histopathologic and imaging findings will be correlated to long-term patient outcome, which is the ultimate goal of our professional activity. I welcome all the members of the diagnostic and therapeutic teams to this short, intensive teaching event.